Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPAcares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and along with me is...
Maddie Norton.
We'll work on that better setup for next time, but I think our listeners are like our trade-off there maybe. But Maddie, it's January. We've started a new year. We've already had one podcast episode so far. We're glad to offer this second episode to folks, but it's not just podcasts that we offer, right?
So true.
You know a bit better than I do what we have coming up. I'm wondering if you could talk a little bit about some of the things on the calendar before we get into today's topic.
Absolutely. So we already have a podcast episode out. Obviously, if you're new to the AFSPA or FSBP plan, listen to that. We give some helpful tips. And then coming up on January 30th, this Thursday at 11 a.m. Eastern Time, we'll be doing AFSPA Live, which will also be about, how to make the most of being an AFSPA member. So please join us for that. If you have any questions, submit those. We have a form that we'll include in the show notes where you can submit them early. If you don't submit them early, that's okay too. You can watch live and submit your questions live and we'll answer them. And if you can't make that time, don't worry. It's all on our YouTube channel at AFSPAcares. You can go back and watch every podcast episode we've done, every live we've done. So definitely be on the lookout for that. In March, we have annual meeting coming up, March 7th to be exact. So annual meeting will be in our DC office from 11 a.m. to 1 p.m. And we're so excited to have members come in or attend virtually because it is a hybrid event. And we will include the registration link in the show notes as well. So please come out and do that. Kyle will obviously be there. I'll be there. We're going to have some great guests as well and a keynote speaker. So be sure to look out for that. And then also we have some Prudential webinars coming up. I know we have a financial wellness checkup almost every month. So be sure to go to our aspa.org/events. That's where we have every event coming up in the near future and all the ways to register for them or know how to attend them. So be sure to be on the lookout for that. And if you didn't know, Kyle does a CEO message every month. So be sure to read those on our webpage as well. And our February one will come out obviously February 1st. So be on the lookout for that as well. I think I've covered everything.
I think that was even a subtle reminder to me to make sure that I've finalized the message soon so we can get ready to send it out. That's great. And I'll just say we've got a fantastic keynote speaker for the annual meeting. It is someone who spearheads research, and we're going to dive into one of the biggest topics we're facing, which is cardio-diabesity. So we're looking at a number of different things tied up in there, but all tied together with obesity, diabetes, pre-diabetes, cardiovascular concerns, hypertension, and so forth, and sort of who it affects, how it affects them, and what solutions are out there, including a focus on the GLP-1 drugs and what they're doing now and the promise for the future that they hold. So I am looking forward to that. More details to come. But we are active. We've got a lot going on. So welcome to our longtime listeners and welcome to our newest members. I hope you'll join us here regularly. Now, Maddie, I want to switch gears after that great overview and talk a little bit about getting care overseas. A lot of our members have experienced this, so I'm not going to pass myself off as an experienced expert in that. I understand how we pay people. I understand how they handle care in a lot of different countries. I'm just curious, personal experience, have you ever had to seek medical care outside the United States?
I have not. I've thankfully been okay every time I've traveled outside the U.S.
I am in a similar boat, other than just maybe a cold here or there. And
Right.
A lot of my travel for AFSPA actually literally takes me into doctor's offices and hospitals but just to meet, thankfully, just to meet with them. I've not had
Right,
to
right.
utilize the services, but I do hear from our members. I know what great care is available. And of course, we've offered a lot of episodes of this podcast, a lot of focus on previous AFSPA Live events about benefits and coverage overseas. We'll have more coming up, but we haven't done a lot of episodes on actual care overseas, and there's one reason. It's different in every country, and you don't know what it is in some cases until you're actually there receiving care. Is it based in doctor's offices? Is a lot of the care based in a hospital? Can you just walk in? Do you need a referral? Will they accept overseas insurance? Do they require cash payment? It just varies so much. But there's one exception to that, and that's back in January 2023. We did a specific episode on coverage and care options in Japan. And this followed a change in access for Department of Defense civilians to on-base care at military treatment facilities. And we wanted to make sure they understood what our coverage is, what options they have for telehealth, and so forth. But that wasn't the end of the story. It has been 2 years, but that wasn't the end of the story. And there's been a lot going on since that time to improve access to care for civilians in Japan. So we ourselves at AFSPA, we've been in touch with a number of members, including a civilian advocacy group who's been incredibly helpful, both in understanding the general situation, but also bringing to our attention acute matters and cases that need immediate attention. We're so grateful to those folks for keeping in touch with us on that. But they've also come to us and said, hey, here's a possible partner facility in Japan who might be willing to work with you. And we've been able to announce some of those new ones, mostly in Tokyo, but other places as well. It's not just been us, it turns out. Throughout that time, the Department of Defense also has been working on a solution which rolled out recently. So that's our focus for today's episode. In fact, today AFSPA talks the pilot program in Japan. And as we get into the episode, we'll make clear this is not flight training. This is a pilot health insurance enhancement program. But Maddie, we've got some great guests today. I wonder if we've got two guests. Can you introduce our first guest?
Yes, we are so excited to have with us Ms. Susan Orsega. She is the Deputy Assistant Secretary of Defense for Health Services Policy and Oversight for the Department of Defense. Ms. Orsega's team provides medical advice and consultation to senior defense officials, Congress, and other Department of Defense stakeholders. Prior to her senior executive service appointment, Orsega retired at the rank of Rear Admiral Upper Half, United States Public Health Service, after 34 years of service as Senior Advisor to the Assistant Secretary for Health in December 2023.
And we also have with us somebody we've been in touch with for over 2 years now, and that's Miss Danielle McCammon. She is the Chief TRICARE Overseas Program under the TRICARE Health Plan at the Defense Health Agency. She manages the TRICARE Overseas Program and is responsible for the requirements, acquisition, and oversight for the TRICARE Overseas contract with International SOS. As a secondary role, she has also been assisting the Office of Undersecretary of Defense for Personnel and Readiness with the Japan Health Insurance Enhancement Pilot. There's the official name. Ms. McCammon has over 20 years experience with the military health system, and we're so grateful to have both of them with us today.
Yes, we are. So let's get into it.
Ms. Susan Orsega and Ms. Danielle McCammon, welcome to AFSPA Talks. Thank you for joining us today. I want to go ahead and jump in to talk about this pilot program, and we're very excited to have you all with us and to be able to share information about this program with our members and others in Japan. Ms. Orsega, can we start with you by talking about the origin of the program?
Well, Kyle, thank you for having us today. We're really excited to be here and talk about the program. You know, we believe it's a great opportunity to inform your listeners and viewers of the new pilot, its features, and the benefits. The Department of Defense really recognizes and appreciates all of the contributions of our Department of Defense civilian workforce around the world and that commitment to taking care of our total force. This program really reflects on our Department of Defense leaders and the commitment to ensure our civilian employees have that improved access to healthcare while stationed in Japan. The pilot is designed to supplement civilian employees, the federal employee health benefit plans, through some additional services that we believe can address some of the unique challenges that our civilian employees seeking care have when they're seeking care in the Japanese system. And, you may have heard me refer to Japan. I think it gives me a chance to really underscore and emphasize this pilot program that right now is only available in that country because there are some current need areas that have been focused. And sort of broadly speaking, the services that our Department of Defense is really underway in terms of a three-prong effort. One is really addressing the healthcare navigation. We know we need to expand the ability for accessing and really assisting with referrals and appointment scheduling with the host nation providers. Number two, coordination of that health insurance coverage. When you're overseas, there are some unique components of that. So we believe that the pilot will impact that. And then finally, that direct payment to medical providers. All of those three-pronged services are being coordinated with International SOS, which we're really pleased to say is a 24/7 call center with bilingual staff and nurses. And the goal is through this program is to manage all the coordination with the federal employee health benefit plans to provide these services.
All right. And you've kind of mentioned a little bit about the needs that you wanted to meet, specifically for those in Japan. Can you get into a little bit more about what drove the creation of the program and then what needs are being met?
Thank you, Maddie. I'll start off and just really say, we've heard from so many of our Department of Defense civilian employees in Japan that they were experiencing difficulty accessing care from some of the local providers. I'm going to turn to my colleague, Danielle, who has the lead, and she can really go into some background in further details. Danielle?
Yes. So one of the biggest concerns that we'd heard was that civilians needed assistance with finding providers that would allow them to book appointments and bill their insurance on their behalf. So it's a cultural norm in Japan for providers to only allow walk-ins and request payment up front as they want to be paid in local currency and they don't want to bill American insurance companies. Another big concern we heard was high upfront costs. Some individuals were being asked to pay upfront costs up to 200% of the cost of healthcare services. Some cases, surgeries costing tens of thousands of dollars. So after hearing some of these concerns, we wanted to develop a solution that was within our authority at the DoD that would not conflict with any existing benefits offered through the federal employee benefits. And our goal was to help the civilians, bridge that gap of receiving care while enhancing and leveraging their insurance benefits.
And we certainly know something about some of the challenges of getting care overseas and trying to crack open the Japanese healthcare system. But of course, you all know this, but we learned at AFSPA this summer that work began right away on a solution over 2 years ago. Ms. McCammon, can you tell us a little bit more about how this solution came about?
Yes, it's been a journey. So, current law and DoD policy, prioritize access to healthcare in the military, hospitals, and clinics for active duty service members and families. And those facilities are resourced accordingly. So when there is appointment availability, those are available to the non-TRICARE population. So the civilian population, contractor population, their family members. But that really limits their ability, to support the civilians on a consistent basis. So the Office of the Assistant Secretary of Defense for Health Affairs worked with the military services, the defense agencies, the DoD field activities. So there's a total of 15, which we call DoD components that have employees in Japan. So what we looked for was a solution, outside of the military health system. The federal employee health benefit plans are, the primary facilitator for the healthcare for those civilians. And we wanted to provide a solution to enhance those services, again, ensuring that those civilians could utilize their benefits to the fullest extent, again, in a complicated Japanese healthcare system. Each of the federal health employee benefit plans were invited to participate. We developed a pilot program, endorsed by the DoD. And we, again, invited these insurance plans. We needed their participation to make this pilot feasible. In the end, not all of the programs chose to participate, but the 5 plans who chose to participate actually represented, prior to open enrollment season this past year, represented 97% of the enrolled population. So that was, pretty good number. And then those 15 DoD components actually covered the cost of the contract that we developed. And so again, that took some time to develop that contracted solution, come up with the funding, and we launched the pilot January 1. And so far we are encouraged by the uptake of the participation. And we also have some evidence that, the post-nation providers are also, excited about this pilot program.
That's an incredible 97% is an incredible number to know that 97% is covered, members are covered through those 5 plans. But I'd love to know a little bit about how does this address specific needs, and then what services does the agreement between ISOS and DoD cover?
So in that contract, the DoD is requiring International SOS. So what we required them to do is establish a network of providers in Japan who were willing to accept guarantee of payments on behalf of those 5 participating FEHB plans. So allowing the civilians to avoid paying upfront for their health care. International SOS was also required to set up that 24/7 call center with bilingual nurses to assist the civilians with locating a suitable healthcare provider, booking appointments. International SOS also had to establish agreements and operating procedures with the FEHB plans, which allowed International SOS to place those guarantee of payments to those providers, allowing them to also pay those Japanese providers in local currency, and then collect reimbursement from the FEHB plans. And then also, International SOS has this experience. They are our contractor for the TRICARE Overseas program, which is the DoD healthcare program, the private sector program for the DoD active duty service members, retirees, and their family members that are located and stationed outside of the U.S. So they're used to, they have that experience. They have a robust network of providers in Japan who are familiar with their operations and billing procedures.
Very incredibly important component for that. I'm wondering, can you tell us who among the civilian population is covered by this program?
Yes, that's a good question. We get that one a lot. It is open to DoD civilians in Japan that are enrolled in one of those 5 participating FEHB plans. Non-appropriated funded employees are also covered if they are enrolled in the Aetna International Plan. And then due to certain regulatory restrictions and because it's a pilot, it does not extend to dependents.
All right, and the current pilot program is supposed to run through the end of this fiscal year, which is September 30th, 2025, for those who don't know. Are there certain criteria that the Department of Defense might use to evaluate the possible continuation and maybe even expansion of this program?
So Maddie, that's I'm really glad you asked. It's hard to believe we're already in 2025. But as all pilots, they really have the start and the end. And so we want to make sure that we get the utilization data and the feedback from all of the users. That's really critical. That 3-pronged approach that I talked about, really getting that and garnering that feedback in terms of accessibility and access to care. in appointments. So Health Affairs has been tasked to look at and evaluate the pilot effectiveness to inform then our Department of Defense leadership decision makers about the pilot continuation and expansion. So the leaders will then consider all of that evaluation, the feedback that we're getting from the Department of Defense civilian employees and the participating providers and the federal employee health benefit programs and the Department of Defense components with the participating employees, and then pull that together and then look at it and evaluate it.
All right, so we're putting it out on our listeners to use the program and to share feedback. And beyond that, before we wrap up, is there anything that you all would like to add for our listeners and beyond?
I'll start off and just really, again, underscore a couple things. Here at the Department of Defense Health Affairs, we are really committed to ensuring that our Department of Defense civilian employees have that improved access to care while stationed in Japan. We understand that it's really challenging, sometimes very frustrating to navigate a new system, and certainly overseas doesn't make it, there offers additional challenges. And while healthcare in Japan is really high quality, the process to access care in a healthcare culture, there are nuances in Japan that differ from that of the United States. We really also want to appreciate the opportunity to talk with you about the pilot program for our civilian employees in Japan. It's really important to understand that, as I mentioned earlier, that this is a pilot, and so it's designed to evaluate all of the components of accessing services. And just as important as that utilization feedback, we want to encourage your listeners and your viewers to use these services to send in the feedback, because you really want to hear from all of you. And then finally, I know I speak for all of the Department of Defense leadership and all of us here. We want to thank those of you who are listening that are serving overseas. We appreciate the contributions of our Department of Defense civilian workforce, not only in Japan, but around the globe for that great work that they do for our nation and all of our service members. And so thank you, Mr. Longden and your organization, for inviting us to come on your show. So thank you.
Well, thank you very much. Thank you for this partnership for spearheading this program. I know it's been a long work in progress. And thank you so much for joining us today. We look forward to further updates in the future. So again, Susan Orsega and Danielle McCammon, thank you once again for joining us for AFSPA Talks. Once again, thanks to Susan Orsega and Danielle McCammon for joining us today. Please check the show notes for today's episode for links to some of the information we talked about, including upcoming events, but also information for those of you in Japan and who are DoD civilians on how to utilize this pilot program. You will find the telephone number for the International SOS call center in the show notes for today's episode. Also, please stay tuned to our feed. Follow us, subscribe, depending on what platform you're using, and look for an upcoming episode where we will talk with representatives from International SOS about the logistics of this program for Foreign Service Benefit Plan members. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and be sure to subscribe and follow AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share feedback with us on Facebook, Instagram, or LinkedIn. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.